Hi everybody, this is Sufia. It's week 57, and this week we are talking about how to start tea in the different areas that we live in. So we all live in different states, I think, and maybe even countries. I think we have some folks in Canada, so we're going to be talking about that today. We live in Asheville, North Carolina, so the western North Carolina mountains, and my understanding with starting tea is that it's more based on a doctor's comfort level with starting that process versus any sort of state regulation around that. So that's my understanding, and that's what I'm going to be talking about is our specific experience here in this area. And the comment section below would be a great place to have more conversation if there is different information out there. So I'm going to talk about Asheville and the process that Mel went through to start testosterone here. So Mel was already a patient of our county's health care system, which is available to low-income residents in the area. And so Mel has type 1 diabetes and was already being seen for that there, which I think made this whole process much easier. In our area, there is actually a trans health clinic, also provided, I guess, by state funds. I'm not exactly sure how they're funded, but it is really low cost to residents of the county. And so since Mel was already being seen there, it was a really easy transition into the clinic. So that is called the Western North Carolina Western North Carolina Community Health Services. We call it WNCHS. So if you're wanting to Google it, Western North Carolina Community Health Services. And they've been around for a while providing different health care for folks. And in 2007 they started a program for trans individuals. And the way that started basically was that there is a doctor there, Dr. Jennifer Abbott, A-B-B-O-T-T, if you're interested in Googling her. And she was treating a patient for other health issues, and he brought up to her that he wanted to transition, and she was really uncomfortable with that at first because she had never treated a trans patient, didn't know anything about hormone replacement therapy, and she was really uncomfortable doing that at first, but then realized that if she didn't treat this individual, that he would not get that health care anywhere else because he couldn't afford it. So she decided to go ahead and do that. So she read up a ton, started doing a lot of research, talked to other doctors, that kind of thing, and his transition went really, really well. And so then her patient base has grown since then. She's been treating other trans patients since then. So there are now about 100 folks in the trans health program at WNCHS. And there's also an individual named Alistair Styan, I think, S-T-Y-A-N, and he is the coordinator of the program. So basically Mel's process with this was that since Mel was already a patient there, they talked to the doctor they had at the time, who they were seeing for diabetes, and said, hey, this is what I'm wanting to do, this is something you're comfortable doing, or how do we handle this? And this doctor connected Mel to Dr. Abbott. And so what Mel did first was make an appointment with Alistair, who was the coordinator of the program, and they basically just had a conversation over the phone, and then Mel went in and they continued that conversation just talking about just all the information that was available at this clinic. So what transition could look like, what resources were actually available, getting prescriptions through the clinic, that kind of thing. It was more of an info session than anything, I want to say. And then, whenever they could make an appointment, as soon as they could make an appointment, so I don't know if it was a few weeks, I think, Mel had an appointment with Dr. Abbott, and Dr. Abbott basically discussed the same kind of things with Mel on a deeper level, and also, I don't know if I want to call it an assessment, but basically just kind of checked in with Mel about, so how long have you been thinking about this? What has your process been? What is your gender identity? What kind of feelings do you have? That kind of thing. There was no need for Mel to be diagnosed with gender identity disorder or any kind of diagnosis. there was no requirement that Mel was already seeing a therapist. Dr. Abbott did recommend that Mel start seeing a therapist who was also provided through the health clinic, just in case things come up, or just to help in the emotional side of transition. But that was not required of Mel. So yeah, there was no letter required or anything. So Dr. Abbott, after the first appointment, after the first appointment, Dr. Abbott went ahead and prescribed testosterone for Mel, and basically it was up to Mel at that point when to schedule an appointment with the nurse to get the first shot. And I remember that being a really kind of almost surprisingly shocking time, because it was just like, wow, that was really, really easy, which was awesome and super accessible, but also kind of like, wow, the ball is completely in my court. It's totally up to me now to decide this. And I remember Mel feeling kind of like, is this really happening? It's all so fast. I thought there were going to be a lot more roadblocks. So a really great problem to have. So then basically Mel made an appointment for the first shot, and that happened on March 1st of this year, of 2013. And so Mel talked to the coordinator, talked to Dr. Abbott, was prescribed testosterone, started testosterone, and then also went to see a therapist at the same time, started that process at the same time, and has been seeing a therapist now for almost 6 months. Dr. Abbott recommended going at least once, excuse me, but Mel has continued doing that just because that feels like a good thing, and has switched therapists in the process because they didn't really like the style of the first person, but I mean, it has been that easy, it's been that accessible, which is such a blessing. It's really amazing. So now it's been over 5 months that Mel's been on T. And so the big thing about this is that we are planning to move. I mentioned this in the last video, we're quitting our jobs at the end of the month, and we are going on a huge road trip and moving. And it looks like the destination is Albuquerque, New Mexico, which is a very different place than Asheville, North Carolina. And so Mel is in the process right now of getting whatever letters or documentation or paperwork that's necessary from this health clinic to make sure that it makes that transition or that move to New Mexico as easy as possible. So, because I'm sure that it could be very different, and starting healthcare with a new doctor there could be different. So I know that Mel is getting from the clinic like a letter saying that they've been on T for a certain amount of time, and just kind of describing what Mel's healthcare is like and why Mel's doing this. And then also some forms to change their name once we get to New Mexico, something that's going to happen there, and gender marker and that kind of thing. So, yeah, so that's basically the process. That's how Mel started T in Asheville. I don't, unfortunately, think it's that accessible everywhere, even everywhere in North Carolina. But again, I do think that it has a lot more to do, as far as starting T, it has a lot more to do with how comfortable your doctor is going ahead with that process versus any requirements from the state. So yeah, I'm definitely open to conversation around this if there's questions or other information. So just let me know. Thanks for watching, and I hope you all have a great week. Okay, bye.